Hello, my name is Anthony Rabe, and I'm an athletic training student from Texas Lutheran University. Bactroban is being prescribed for your impetigo infection. Bactroban is very important to use even though the rash does not cause you any pain or loss of function. If without the Bactroban, the rash will spread more on you and to other people. If left untreated, you cannot participate in your sport. You must use the Bactroban and not just Neosporin. Neosporin will not help heal or kill the bacteria within the impetigo. Neosporin does not work on this type of bacteria. Bactroban kills the Staphylococcus by stopping the production of protein within the bacterium. Before applying the ointment, make sure to clean the area with soap and water, and then apply the ointment to the area. This needs to be done 3 times a day for 10 days. When you are done applying the ointment, it is important to cover the area with a Band-Aid or gauze pad and then a cover. This is important to stop the spread of the bacteria to other people. It is also very important to be cautious when you are applying the ointment as to not get the ointment into a cut near the area. Some of the side effects that can happen when using Bactroban include nausea, burning, headache, pain, and stinging. If any of these side effects occur, feel free to let me know. Also, make sure that you are washing your hands after applying the ointment, as well as cleaning the area every time you shower. The Bactroban will reduce the risk of spreading to others, but it is a good idea to take further measures to prevent future spreading. After taking the antibiotic for 24 hours, you can return to activity. That includes practice and games. But it is important that you use the medication for the entire duration of the prescribed time to properly get rid of all the harmful bacteria. The antibiotic will allow you to become active again in your sport, but you have to be using the ointment while you're doing it. To prevent future outbreaks, you need to be more proactive in cleaning your clothes and yourself after practice. It is better to shower right after practice than to wait and forget. It also would be a good idea to wash your sheets and towels when you get back to your dorm. Impetigo can be prevented by keeping proper hygiene. Just remember that you need to clean the area every day, 3 times a day, and put the Bactroban on the area 3 times a day and keep it covered. Hello, my name is Anthony Rabe, and I'm an athletic training student from Texas Lutheran University. Bactroban is being prescribed for your impetigo infection. Bactroban is very important to use even though the rash from your impetigo does not cause pain or loss of function. Without taking Bactroban, the bacteria can spread to other areas on your body or to other people. You need to use your ointment of Bactroban and not Neosporin. Neosporin will not kill nor treat the area. Neosporin will keep the area moist, which helps bacterial growth, especially with the large amount of bacteria that is in that area. Bactroban kills the bacteria by stopping the production of protein within the bacterium. Before applying the ointment to the area, make sure to clean the area with soap and water. Apply the ointment to the area. You need to apply it at least 3 times a day for 10 days. When you are done applying the ointment, it is important to cover the area with a Band-Aid or gauze pad and then have the gauze pad covered. This is important to stop the spread of the bacteria to other people. It is also very important to know to not mix or use other lotions or ointments with the Bactroban. The mixture of lotions and ointments can cause the antibiotic to become ineffective in killing the bacteria and can keep an environment that bacteria can grow in. It is important to be cautious also when you are applying the ointment as to not get the Bactroban into a cut. Some of the side effects that you can have with Bactroban include nausea, burning, headache, pain, stinging, and dry skin. If any of these side effects occur, you can come talk to me if you want. If any, make sure that you are washing your hands after applying the ointments as well as cleaning the area every time you shower. The Bactroban will reduce the risk of spreading the bacteria to others, but it is a good idea to take other measures. After taking the antibiotic for a day, you can continue activity in practice or games. It is important, though, that the medication be taken for the entire duration of the prescribed time to properly get rid of all the harmful bacteria. The antibiotic will allow you to become active again in your sport while using the ointment, but we must make sure that we cover the area. To prevent further outbreaks and future outbreaks, you need to be more proactive in cleaning your clothes and yourself after practice. It is better to shower right after practice than to wait and forget or do it hours later. Impetigo can be prevented by keeping proper hygiene. It would not be a bad idea to go and wash your sheets and towels now after you've been diagnosed with this. Just remember that you need to make sure the area is clean and that you use Bactroban at least 3 times a day and to keep the area covered when you're in public. If you have any questions, you can come by and ask me.